And then since Delegate Cullison is on, and I know she has something else, we'll go to 498, then 322, 488, and 599. So I hope to not screw that up because I'm just writing numbers on my page. Okay, so Delegate Lopez, HB 372. Lindsay, can you tell us what the bill is, please?
Yes, thank you. This bill generally codifies the Federal Emergency Medical Treatment and Labor Act, known as EMTALA, in state law as it relates to an emergency pregnancy-related medical condition. If a hospital determines that a patient has an emergency pregnancy-related medical condition, the hospital must first, using the staff and facilities available to the hospital, provide further examination and the treatment required to stabilize the emergency pregnancy-related medical condition, including the termination of a pregnancy when medically necessary to stabilize the patient, or two, transfer the patient to another medical facility. A hospital must allow the termination of a pregnancy at the hospital if the patient's treating healthcare practitioner determines termination is medically necessary to stabilize the patient. A hospital is prohibited from taking specified adverse actions against a provider for not transferring a patient who's not stabilized or against a hospital employee who reports a violation of the bill. And the bill also establishes civil penalties based on bed capacity. There are no amendments. The cross file of this bill is Senate Bill 169, which passed the Senate with no amendments, and the vote there was 32-11.
Delegate Lopez, do you want to chime in with any information?
Sure. So as Lindsay mentioned, the Senate version of this bill passed third reader with no amendments. Appears to be a party line vote, and we're hopeful we can move this bill along expeditiously as well.
Any other discussion? Yes, Delegate Schlega. Could you unmute, please?
I put my video on and forgot to put my sound on. So to the sponsor, Delegate Lopez, I know MedStar Health has a Catholic hospital. Have you addressed their concerns?
So what this bill does is just codifies what their practices already are. So there's no specific accommodations that need to be made that haven't been made already to help MedStar and their facility.
And so if you're doing that, why do we need the bill?
Because it's a matter of enforcement at the federal level.
So this is a bill that you're worried about President Trump?
I think in general, we're living in kind of volatile times. So we need to put protections that we originally believed to be there, but are not intact. So I don't think it's particularly, I wouldn't say it's like one particular person. I think it reflects an era that we're in.
And so the Catholic hospitals that came in, were you able to address their concerns?
I mean, the bill itself provides them the appropriate amount of protections and oversight for the facilities, and also like just codifies what we're already doing for conscientious objection. So there's really nothing outside of what's in this bill that needs to address their particular needs.
Thank you.
Madam Chair.
Yep, Delegate Cullison.
Thank you. Just having a question. What's the position of the Maryland Hospital Association on the bill?
Sure, that's a great question. They are neutral, and that comes after a lot of work done in coordination and partnership with them, where they could feel comfortable about the bill.
Great. Thank you very much.
Any other questions? Seeing none, do we have a motion to move the bill?
I had my hand up.
Oh, I'm sorry. I didn't see a Delegate Alston. Please go ahead.
That's okay. Thank you. Just to be clear and for the record, nothing in this bill will require a person who has a religious objection to perform an abortion, correct?
That is the current law, and that will remain the law once this bill is passed and enacted.
But what the bill will do is make sure that if a person comes to the hospital, that the hospital itself will have to provide the care and they can find someone within the hospital who doesn't have that conscientious objection
That's
stabilize
absolutely
the
correct.
patient.
Yeah,
And it's to
that's why
provide
this is in a health
stabilization.
facilities
Right.
subcommittee.
Okay.
Yeah.
Thank you. Just want to be sure. I understood.
Delegate Kipke?
Just for clarity, what was just said there is they would find somebody to stabilize the patient. It's more than that. It will find somebody to potentially participate in the carrying out of an abortion. Isn't that correct?
Well, there's three components of EMTALA, right? That prevent patient dumping, which is the problem that historically has been tried to be addressed with this legislation, right? So the first part is an assessment. When you show up to an emergency room, regardless of which hospital it is, regardless of your ability to pay, they will perform an assessment on you. The second part is stabilization, right? It's possible that in the case of a very complicated miscarriage, a procedure to terminate a pregnancy as a result of that miscarriage might be a part of that treatment to stabilize someone. If someone's hemorrhaging, if there's sepsis, like I mean, you could have an ectopic pregnancy. The list goes on and on and on of hypotheticals that are not actually hypothetical at all. They're very common, right? The third part of that is there has to be a transfer, if that's appropriate, if when necessary. So to your point, yes, but it's a life-saving treatment that needs to be given to stabilize that patient.
Well, to be clear, the stabilization is common practice. There is no hospitals in Maryland that are not stabilizing. What this does is, and correct me if I'm wrong, is it forces the hospital, even a Catholic hospital supported by Catholic charities, to find somebody in the facility to go beyond stabilization, but to participate in an abortion. Is that right?
I think there's a misunderstanding of how comprehensive the term stabilization is. There are times when, in order to stabilize a patient, what is called an abortion is performed. An abortion is a broad medical term that means any intervention to terminate a pregnancy. So that means if you are having a miscarriage and it's not complete and you're struggling with that and you're bleeding and your life is in danger, stabilization would require ending that pregnancy, would be a completion of the miscarriage that's medically assisted. So the stabilization does include abortion practices, but keep in mind, abortion can be a broad term as well.
Are there any hospitals in Maryland currently not stabilizing a patient?
We've heard individual stories where this was an issue, and perhaps there's someone here I don't want to take anyone's thunder if they want to jump in and add clarity here, but we've heard stories of this happening, and so it comes from a very real place.
But just one last final question. Was there any testimony in the bill hearing that women are being not stabilized in Maryland's hospitals?
I'd have to look through with a fine-tooth comb to see if particular instances were mentioned, but I know in the process of speaking to various advocates, speaking to my Senate cross file, there were particular incidents that were mentioned. One of them was referenced in a Baltimore Sun article that I think that's the reference in some of the testimony, in the written testimony we received. Delegate, if this is of particular concern to you, I have no problem digging that article out and sending it to you, but it does have to do with the local Maryland hospital, not in your district, but in the state.
Thank you.
I see that Robin Elliott is on with us as well, and I know that she has a depth of knowledge. Do you have any information in that space?
Sure. So Robin Elliott here on behalf of the Women's Law Center of Maryland and the American College of Nurse Midwives. So religiously affiliated hospitals do already have protocols in place that permit the provision of abortion care in an emergency. and they have protocols that they have to follow. So this law is really not changing what those hospitals are doing. It is essentially giving Maryland the ability, if any hospital, secular or religiously affiliated, doesn't provide this emergency care, that the state could come in and investigate and make a determination if the care should have been provided, because the concern is that the federal government won't at this point in time. So it's codifying current practice.
Thank you. I'm sorry, I saw Delegate Bross was on and now I don't see her on the screen, so I was just scanning to see if she's coming back up or not. I don't see her. There she is. Okay, Delegate Ross, I had lost you. I'm glad to see you're back. Are there any further questions or discussion?
Do we have quorum?
I believe so. Yeah, I think we have everybody. The committee is myself, you, Delegate Johnson, who is on, Delegate Kaufman, who just got on, Delegate Kipke, Delegate Ross, and Delegate Schlegel. I believe all of us are here. If there's no further questions or discussions, can we move the bill? Anybody?
Move the bill.
Do I have a second?
Second.
Thank you. All in favor? Raise your hand.
Aye.
So I've got Alston, Johnson, Delegate Kaufman, Delegate Ross. Any opposed? Delegate Schlegel, Delegate Kipke. Delegate Ross, are you there? Okay. So the bill passes with 2 votes against. Thank you. Let's go, if it's okay with everybody, we're going to go next to Delegate Cullison, HB 498. Lindsay, can you share with us about that one, please?
This bill repeals the current exemption from a certificate of need for a change in bed capacity at an intermediate care facility that offers residential or intensive substance-related disorder treatment services and has a current license issued by the Secretary of Health. Instead, the bill specifies that a CON is not required to establish, operate, or change the bed capacity at an intermediate care facility if written notice of the intent to establish or operate the facility or change bed capacity is filed with the MHCC at least 45 days in advance, and MHCC finds that the proposed facility or change in bed capacity is not inconsistent with the state health plan, will result in the delivery of more efficient and effective healthcare services, and is in the public interest. So essentially, it's not a full CON process. It's like a streamlined review by MHCC.
Thank you. And there was no opposition to this. There were no amendments and no fiscal impact. Any questions, concerns, discussion? Delegate Cullison, please jump in.
Oh, I just want to thank the committee for its consideration and be clear that the CON.
She froze.
She did.
Still
She freezes a lot. We should get
exists
IT
for
in there.
establishing the would be implemented. Well,
We didn't get a lot of that because you froze, but
oh, okay. Am I alive now?
you seem to be, yes.
Just Thank you to the committee. Just want to, just be clear, the CON is still in place for the original establishment of the facility. This expedited process occurs when they're expanding beds, just to make sure that they have the capacity to meet those, both in terms of space and staffing to meet the needs of the patients in those beds. So thank you for your consideration.
Okay. Any further discussion? This motion to pass the bill. Second.
Second.
Thank you. All in favor?
Aye.
Any opposed? Seeing none, bill passes unanimously out of our subcommittee. Thank you. Okay, let's go to, I've got too many papers here. Let's go to,
I see that Delegate Hill has joined us.
yes, let's do Delegate Hill quickly so she can go back to her other subcommittee or prepare for her subcommittee meeting. That's HB 599. Lindsay?
This bill requires a hospital in order to be licensed on or after October 1st, 2026 to qualify as a nonprofit organization under federal law and be registered as a nonprofit organization with the state. A hospital licensed on or after October 1st, 2026 must maintain status as a nonprofit organization as a condition of licensure, and ownership of a licensed hospital may be transferred only to a nonprofit organization. There were no amendments on this one.
Also, no opposition and no fiscal impact. Delegate Hill, anything you want to share with us?
I think you said it all, Madam Chair.
Okay. Do we have a motion to approve this bill?
Move the bill. Second.
Thank you. All in favor of passing this bill back out to full committee?
Aye.
Any opposed? Delegate Schlega? Okay. Delegate Schlega is opposed, but otherwise everyone is good. So we will move this forward. Thank you.
Thank you
Thanks,
very much.
Thanks, Delegate Hill. Okay, let's go to HB 322. Please, Ken Kerr's bill.
This bill, as originally introduced, alters the membership of the Maryland Healthcare Commission by reducing from 9 to 8 the number of members who do not have any connection with the management or policy of a healthcare provider or payer, and adding one additional member to be, again, as originally introduced, a representative of a hospital. So it keeps that total number at 15. When appointing members of the commission, the governor must assure that at least 4 rather than 5 members are residents of different counties with a population of 300,000 people or more. In the bill hearing on this bill, the sponsor spoke orally about introducing an amendment to match this bill to the Senate cross-file. So I circulated that to you all. The amendment requires the representative of a hospital that's added to MHCC to be an administrator of a hospital. The Senate Bill 260 passed the Senate 44-0 with that amendment.
This bill also has no fiscal impact. I don't believe that Delegate Kerr is with us. But any discussion?
Move the amendment.
Second. Second.
Okay, all in favor on the amendment?
Aye.
Any opposed? Okay, can we move the bill as amended?
Move the bills amended.
Second.
Thank you. All in favor? Okay, any opposed? Thank you. Move that one forward. The last bill is HB 448, which is Delegate Rosenberg and Lindsay.
This bill requires the Department of Health to conduct at least 2 unannounced on-site inspections of each certified recovery residence annually to ensure compliance with statutory and regulatory requirements. Unannounced inspections must be in addition to the inspection for recertification. If after an unannounced inspection, MDH determines that a certified recovery residence is not in compliance with requirements, MDH must provide notice to the certified recovery residence of its deficiencies and allow 1 month from the notice to address them. If the certified recovery residence fails to take corrective action within 1 month, then MDH may instruct the credentialing entity to revoke the recovery residence's certification. I didn't circulate amendments on this. There were a lot of amendments suggested in testimony on this bill, some of which conflicted. So it's sort of up for discussion. And I will note also that the fiscal impact of this bill was listed at least 373,600 beginning in fiscal year 2027 for the staff to conduct those additional inspections.
I don't see, oh, there he is. Delegate Rosenberg. Did you want to share anything about this bill?
Okay, the purpose of this bill is to assist people who are really in the most often the first time home buyer, so that they maintain their property and don't lose it by their failure to make various payments along the way. And the amendments that I have offered, have you already discussed?
Delegate Rosenberg, we're talking about HB 448, which is about the recovery residences.
Oh, I'm sorry.
That's
Wow.
okay.
I was thinking of another bill. Thank you.
No problem.
Put in a lot of bills, you get a lot of subcommittees. This bill is an attempt to make communities more aware of the availability of this information. I'm sure every member has had to support his or her community when they wanted to oppose the presence of one of these facilities in the neighborhood. But even though we're put in a position where we're acting counter to the policy that we've adopted in Annapolis, that people are better served in the neighborhood. So the bill would require unannounced inspections, but I've spoken with your Chair Gazone, and it is fine with me if the chair of the committee, the full committee, informs the department of our concerns and get some statistics on how this has been implemented. I did not even know that there was an annual inspection. Okay, it's something I didn't know till we started working on this bill. So for the chairman to convey to the department, the full committee's concern about this issue, and asking for information about inspections that have been performed on properties, what's been the response if there were issues raised about the merits of the services being provided at these properties. And also making available, I mean, I don't know if any of you would know about the portal where the community can register its concerns about how the services that are being provided, consistent with the integrity of the system and with the privacy rights of the people, who are living in the facility and being assisted, we hope, by the facility.
Sure.
So with that understanding and commitment, I would not be asking the subcommittee to move forward with the bill at this time.
Okay, so we'll hold that until we can get a little bit more information. I know that we are trying to be able to have a conversation with the Department of Health also. We'll go ahead.
Also, if I may, this is a cross file, so I need to check with my senator.
Yep. So we'll go ahead and hold this for a week and come back next week and tackle the bill. And
thank you.
Yep, you're welcome. And I believe that covers all of our bills. Right, Lindsay? I've checked off everything. Thank you for
that was it.
Thank you all for your time and effort, and we will see you in committee, or at least some of you in committee, at 1:30. Thanks, everybody.